So, welcome to this mental health, health and care overview and scrutiny panel meeting, 10th of January via Zoom. It's a public meeting and this is being broadcast. Can I ask, just the housekeeping as we usually do before these meetings, that you turn off your microphone and video and only turn them on if you're going to speak. Jen may put everyone on mute if there is feedback or background news, so remember to unmute yourself when you need to. Please remember to raise your hand via Zoom if you'd like to contribute, and don't forget to unmute and use camera when you're speaking. We've got a number of guests. I think we've got half a dozen guests here this evening, plus the councillors from the panel. So rather than go around to do introductions, because we've set aside an hour for this meeting, I prefer if people would introduce themselves when they're going to speak. This evening, we are going to share the findings and recommendations from our review on mental health. I will be focusing on our external partners and our internal partners because the panel have had the opportunity to look at this already, and it will give more of a chance for our external partners to make any comments, feedback that they want to. This is the first opportunity that I've had to do so in a public meeting. Quickly running through, we are joined by Dale Birch, who's the Executive Member for Adult Services, Health and Housing, Gonya Siggins, who's the Executive Director for People, Bracknell Forest Council, Tony Dyer, who's the Assistant Director on Mental Health and Out of Hours, Nadia Barakat, Director for Mental Health, NHS Frimley CCG, Aidan Jordan-Jones, is also Frimley CCG, Hema Shukla, Consultant in Public Health, Bracknell Forest Council. I think I've got everybody there, and panel members, if you could introduce yourselves as you come into the meeting. So first of all, can I ask for apologies for absence?
Yes, we've received apologies from Councillor Mrs Mackenzie and Councillor Temperton.
And do we have any declarations of interest? I'm not seeing any hands coming up, so I will take that as no declarations of interest. So I think we've got a fair amount to get through tonight. So without further ado, Jen, could you bring up the slides for the draft recommendations? I just want to start screening and see the... I can't tell if that's me or you. Right, thank you. That's on the screen. I hope everybody can see that. I'm not having any indications that you can't. I would say two things at the start of this. Have we got anybody? Is there anybody outside? Or have we got an issue with Jill? All right. Well, I've just had a message that the chair of the other over scrutiny panel, Councillor Jill Birch, is unable to get into this meeting, but hopefully we will try and do that. Right, so the draft recommendations, I want to say two things at the start of this. Thank you for the panel's work on reaching these recommendations, and thank you to our partners, both internal and external, for the work that they've put in helping us to get to these recommendations as well, and I hope comments will reflect that. We must bear in mind, though, that this is a snapshot of the interviews that we carried out and the information that was sought over the last few months of 2021, and it's not necessarily a reflection of the current situation as Omicron has impacted the services. So I think all sort of council documents come with that caveat at the moment, but it is, I still think, very relevant that what we've carried out here and will help in whatever situations hopefully we find ourselves. So if I could ask Jen for the next screen. I don't propose to read through each screen that comes up. I don't like death by COVID. Hopefully you will have had a chance to see these slides beforehand. But this is really because of the review was basically because we knew that there was a lot of concern and wanted to see how this had affected the various partners providing the saves services they provide. So I will take questions at the end, but if anybody thinks there's something that they really want to come up with, I'm more than happy to take questions or comments throughout the throughout this presentation. So as we can say, the main aims for this were to make sure that people can access support, and that's the sort of golden thread that runs through the recommendations, while we've commented on other joint work that's been going on at the same time, and hopefully in some areas been able to increase on that. Can we have the next slide, please? As you can see, we've had a number of partners involved, also senior officers from Bracknell Forest Council, who have given us evidence to provide what we've done. And the thanks that I said at the beginning of this presentation, I would just like to reiterate. So as you can see, there's been for a number there that have come forward with this. Jen, can you give me the next slide, please? I think this is key in the mind of all the panel, is the impact that the pandemic had and is having as we speak. A few things that we didn't quite expect was seeing how many more users are coming from younger age groups, and how people are adapting to it. There is a large amount of services, and the huge amount of effort coming in from various staff, nurses, has been phenomenal, and it almost seems blasé after nearly 2 years to say what fantastic work's being done. But even now, our thanks go out to those that are continuing to work. We have looked particularly at early intervention, voluntary sector services and self-referrals in this. So we haven't gone into beyond primary care to secondary care on this. Next slide, please, Jen. Three of the key findings that people are trying to improve the engagement. By the way, Jen, my internet connection is unstable. If I suddenly drop out of this, would you and Isabel, if she's isn't having the problems with her, please take over. Improving engagement, barriers to self-referral, and things like the community map. It's not a recommendation in itself, but it is a key resource, and we have a few suggestions within that, which hopefully will be fairly obvious with how we're moving forward. Next slide, please. Some things have popped out. Unsurprisingly, hard to reach communities. It had been noticed that these were this was an issue, and we hope that the communication opportunities will improve these in this area. Budget pressures. Budget pressures with the demand-led service are always difficult to predict. I think it was very helpful that we did check through to see there was nothing unusual, but predictably, it as a demand-led service, particularly during a pandemic where previous models can't be relied on how to predict. But it does mean that our officers were very conscious of this and have been looking at what's going on through a rapidly changing area. Strong relationships and collaboration. We found good working relationships across the organisations. We would say that, wouldn't we? But it's actually very pleasing to find that in this area that means so much to so many people, because it has impact on so many different lives, that we do have these good working relationships. And the proof in the pudding was how this review panel was greeted and treated by colleagues involved in this field. Jen, could you give me the next slide, please? So all users reacted positively to being when we were speaking to people, they found that they've been worked with, and this actually meant that they felt more confident in using the services, and this is reflected in what Frimley have said in our ICCS strategy 2019-2025. Also, that the online support has been an improvement as a blended service, because while there are issues with not having face-to-face, the fact that people can actually access services through online areas has been very helpful. And we were, at the time of this review, looking at good practice, seeing that some physical activities were being brought in. Obviously, recent events may have had an impact on that. Next slide, please. So here we get to the meat of it. So there's draft recommendations. We've badged together a lot of the ones under the Health and Wellbeing Board, because it is being considered, and we were hoping that these ones would be accepted by that board. This is under the creating, relaunching an improved version of the community map. Next slide, please. So this is a very small type, and I apologise for that. Anybody who's got issues in reading it, you could always pause and read while it's on your screen, if that makes things easier. We've mentioned the community map and what's going forward, and it's providing an opportunity to engage with the public, which is part of what the review has been putting forward. Our recommendations for 5 to 7, we still are looking at dates, which hopefully you might get tonight, but if we don't, we've still got the basis of what's going forward under 5, 6 and 7. And that's to do with the executive, the CCG partners, signpost relevant mental health support as part of initial telephone menu. We think that's going ahead, but we're not sure of the timings of that. Next, please, Jen.
That is the final slide, Chair.
Oh, sorry, I've got an extra one saying questions on mine, but
I can bring that one up.
Right, so I've danced very quickly through those because I thought there was something there. I know some of my colleagues have to leave for another meeting from the panel, but this is the opportunity for our partners, internal partners, to make any comments. Who would like to kick off? I haven't got any. Okay, to the panel. Isabel, as Vice Chair, would you like to make your comments, and then I shall go to Michael. Isabel, you're on mute. If you can unmute yourself.
There's my computer. Sorry. I was very impressed about how some of the organisations are actually collaborating together. But I was particularly impressed with the 2 individuals who actually were helping each other when they were talking about their difficulties. And I thought that was great news, because I thought that showed great initiative on patients who actually knew they wanted help and they worked with each other. I was delighted with that.
Thank you, Isabel. Michael, you've just disappeared off my screen completely. Oh, there you are.
I hope not. No, I've reappeared. Thank you, Mike, for that.
Councillor Michael Brossard.
Yeah, Mike, given the expectation that throughout the country, Afghan refugees may be accommodated within the boroughs. Is there any mechanism that we have to understand those who've suffered trauma, mental health issues and such like? What I'm asking, I suppose, Mike, is what will be the challenge that we will face in terms of the language situation for those who have come from abroad? Is that something that's been taken into account, and is there a solution?
I think I will go over to Mr. Councillor Birch on that one. Councillor Dale Birch.
Thank you, Chairman. Councillor Dale Birch here. Specifically to the point raised by Councillor Brossard, each of the asylum seeker families are assigned a care worker and a case officer, and they assess each of the asylum seekers' needs, and they then engage the appropriate agencies to deal with them. So if it is mental health, trauma support, they know where to go to get that support, and the councils are here and around the country have that support available. And I do know that here in Bracknell Forest we have received a number of asylum seeker families, and they have been made very welcome. Their support workers have engaged them with the proper level of support, whether that's mental health or even to assist in getting a job. So, Chairman, specific to Councillor Brossard's point, if they are found to be in need of mental health support, it is provided.
Thank you very much for that, Councillor Birch. Nadia, is this on this point? Or is it a question, or is it statement on this point? Okay, Nadia, and then I'm going to go to Jill and back to Isabel.
Thank you. Just to echo that, in other parts of Berkshire, we have received asylum seekers and refugees, and that local services have mobilised to support, particularly around mental health and understanding some of the mental health issues, because as you've quite rightly stated, some of those individuals will have experienced some significant trauma. So Berkshire Healthcare Foundation Trust have stepped up to support those individuals, either as individuals or families, with the right provision and capacity. So it would be the same situation if that happened in Bracknell Forest.
Thank you very much. Jill, you've got your hand raised. Councillor Birch. Jill Birch.
Thank you, Chairman. Sorry, I did send a couple of comments in this afternoon, but I was working off recommendations in a different order. So I do apologise because I've got to nip to somewhere else now. But I did send them to you and to Jen. Just one typo and one where I thought we needed to add another word, but I'd got it as 3D and 3J and 4. And I just wanted also...
We'll be looking to incorporate those. I don't think the things that you've said are actually contentious in any way, shape or form. So yeah, I'll get back to you. And I'd just like to put on record, thanks for joining this review. As you're chair of your own panel, a very busy councillor. Thank you very much for your support and your comments all the way through dealing with this. Thank you very much indeed. I know you have to go because you're involved in another meeting.
I know. And number 6, it was before, but it was about actually making sure. Perhaps I should have got it up on my other screen, the one that I've got. Anyway, I just wanted to add a sentence which I've actually added in, so you and Jen can.
We will look at that if you don't mind. We'll take that on board.
Okay, well, thank you very much, and you know, I think it's brilliant, and I do support. Also, I wrote in that email, I support the recommendations. So well done.
Thank you very much, Councillor Birch.
So I say cheerio. Good night.
Good night.
Right.
Isabel,
Thank you. I'd like to ask Dale. Ash and I went to a function at the Open Learning Centre where some classes taken place from people from Afghanistan, all sorts of places, learning about our culture and questions, which I'm sure when you get the knowledge, it helps your mental health. Are the new people coming in, will they be referred to that service as well?
Dale, did you want to answer that, or do I go to
the short answer to Councillor Mrs. Mattick is yes, they will if they are found in need of that service. So the close wraparound support that our refugees and asylum seekers get will identify if they need those types of general support, just with how things work in the community, in this country and in this community, etc. It's not just about teaching them the language. They do get support with how to apply for jobs. They do get support with the benefit system. My goodness me, that's a minefield enough. So they are very closely monitored, and they get the support that they ask for and or are needed. And as Nadia said, particularly on the mental health stuff, services are commissioned directly for them.
Yes, well, I can understand a lot of those people, they did say how much they appreciate the service. So I'm sure as many people as possible can benefit. Thank you for that.
Thank you, Councillor.
Dale, thank you for that very full answer. Isabel, if I can ask you to take your hand down, if you wouldn't mind. I'd like to focus now on Nadia. Do you want to order that before we go back to the main focus of the recommendations and comments on?
No, I was going to just pick up on the main recommendations.
Right, excellent. That's where I'd like to go now and give you the opportunity to give your feedback, comments, or anything else you want to say. Thank you, Nadia.
So just to say thank you for quite a comprehensive review. I think when we've had a look through those, it's really chimed with some of the things that have been happening that we've been hearing through our CCG and our work. And we're really supportive of the recommendations. And we think we've got some really good ideas in terms of testing some new ways, particularly around self-referral and people accessing help themselves, rather than not necessarily going through the GP route. So also Dr. Katie Simpson couldn't be here today, but was also very supportive of those recommendations.
Thank you. It's very kind of you to say so. I'm glad that that we have been working together on this. But before I get too happy about that, Councillor Birch, you've got your comments.
Thank you, Chairman. As you've moved on to the recommendations, your slides were slightly out of the order that I'd been sent a copy of, but nonetheless, my comments, if I may, just to go through what I understand to be number one, which is the executive works the primary and voluntary provider opportunity to be present in community spaces such as Times Square, etc.
Yeah.
That just the comment that to achieve that, we need to work with more than just the People Directorate, because the People Directorate doesn't always have control of libraries and the Times Square square footage as such. So we will have to broaden, which is good, the responsibility, shall I say, for delivering that. That's not something the People Directorate on its own could deliver, because
I take your point.
Other people have a say over what goes on in that space. So the commitment is fine. All I'm saying is you might have to ask one or two more people to get involved in order to make sure it is an integrated and joined up way of delivering that particular point.
I
That's
think
all on that.
I totally agree. It obviously does cross the divide between different executives' responsibilities. We're hoping that somebody will take forward so that we've got a lead exec member, while recognising that it will.
We'll have to find you one. Yeah. Sorry.
So yes, you're absolutely right, but we do want to pin it on someone who can sort of liaise within that as the part of the recommendation. So
Yeah,
it's
well,
a very useful comment.
May I suggest that when you bring this before the executive, that you canvass for that joint responsibility? That's a good opportunity to do. Can I move on through these? I just want to do this quickly because, as I say, there's no Gurnash against any of it because it's been a very effective piece of work. But I did wonder whether you could, in my list 5 and 6, which are ensures training of the community assets, etc. And then you've got, and that the health and wellbeing includes an event as part of the relaunch. I wondered if those two could be joined together, because if you were to do a relaunch, part of your relaunch, I would contend, it would involve then setting up and agreeing training for all parties once everybody was happy with the new community asset map and accessibility. So I wondered whether there might be a bit of mileage in joining that up. Nice relaunch of the community asset, and with it a training on it, etc. Joining the two together, making it all happy. That was all.
I see where you're coming from. The issue, because we have discussed this, was that there are different audiences in which we're actually looking to get the training. So we've spoken, because originally that was our idea, was to do it that way. We've had to split some of it out because the different audiences that would be participating in the training and their availability. So we were advised by our partners that, for instance, one of the groups might get a lunchtime because that's when they would do their drumming in their professional lifetime, while some of the things that would be going to, say, the public and accessing the public would be different. So that's why they're separated out like that.
Lovely. And of course, as one of the comments makes there, as we are about to go out to all partners to consult on the health and wellbeing strategy, members have had the chance to contribute to that. And there is an excellent section about mental health and isolation and loneliness within the health and wellbeing strategy. So the recommendation to join up that the health and wellbeing strategy work with the relaunch of the map and the emphasis on elements of mental health, absolutely supported.
Thank you very much for those comments. That's most welcome. I'm looking to our other partners if they've got particular comments they want to make about their recommendations that affect them. So Nadia, you've spoken. Thank you very much, Dale. If I go down to, I'm not trying to put anybody on the spot here, but if you're happy with what's said, that would be enough. But if I can go to Gronya for your comments.
No, thank you, Chair, and thank you, colleagues. Am I on screen now? Sorry, I can't see. No, that's it. Is that now?
Yes.
Yeah. No, and then to welcome the Commission and thank everybody who's taken part. It's clearly a significant amount of work looking into this very important topic and the support we provide to our residents who have got mental health issues. Very comprehensive and more than happy, Chair, with the recommendations, and will support the implementation of them.
Thank you very much indeed, Gronya. Just going down, Tony. I'm just picking off the list as I go through. So I'll go to Tony and then Hema. Tony.
Thanks, Chair. Again, I can only echo what Gronya said. So completely welcome the review. You can see the amount of work that's gone into it. and fully support the outcomes and will help drive them through for Bracknell. So thank you.
Thank you very much for those. And I'm just going to go to, do I said next? Hema, sorry, there you are.
All right, well, thank you very much. I think this is definitely a very good piece of work, and in Public Health, we're very delighted with this. The whole team was delighted with the recommendations, and we fully support, and this supports us doing the work in health and well-being across partners as well. So it's a win-win situation.
Thank you, Hema. I'm moving to Tony and Nadia. I've seen Isabel. Nick, Aidan, do you have? Actually, going through the names here.
Hi. Yeah, I was just trying to think of the next steps. I mean, I hadn't seen the presentation before, so I was just wondering, is that going to be sent out? Then I was wondering, Jen, maybe because we have a local group with Tony and Hema, if you wanted to come to speak to that, because there's a couple of points that jump out for the CCG. I know one of them was working for putting in the direct referral to Talk Plus for the phone line, and also looking at different information for the websites that jumped out. But maybe just kind of looking through the other areas if there's anything in which organisation can help with them.
Yeah, I think sort of as the recommendations go, any sort of further dialogue can only be looked at in a positive way for what we can take forward. Because we went and looked at some budget issues, we've actually changed the timings of when this was going to be reported. So it won't be going to the ONS Commission until the 7th of April now, because the next meeting's on Thursday, and obviously we don't have time to go straight to that one. So we won't be going to the executive to the 26th of April. So there are bits of this that could be either fleshed out or looked at in that respect. If that's your concern about doing more time, then I'm sure if you talk to Jen, we can actually see what that looks like.
Okay. So I said Talk Plus, but I meant Talk and Therapies. Talk Plus is from a previous job.
Oh, right. Okay.
Yeah.
Nadia.
And just following on from that, given where we're at with Omicron, so things are a little bit, we're just kind of watching and waiting to see what's currently happening with lots of people being redeployed and the trust under pressure. So if we can have some flexibility with some of that, those deadlines, that would be absolutely brilliant. But I think we just got to see what's kind of happening in the next couple of weeks, and then we'll be a bit more certain about where we're at.
Absolutely. I mean, as I said at the start of the presentation, this is a snapshot of where we were. The new variant and possibly variants after that will always have an impact. And I don't think that any document is going out without the COVID caveats, if I can call it that at the moment. It's putting, we've talked about, look, we're emerging from this, there's more activities going on in there, only to suddenly find ourselves. So it's a roller coaster of ups and downs, unfortunately, with the downs certainly facing us at the moment, and stretching our resources internally, externally, as the variants impact. So I couldn't agree more, and it's certainly part of the recommendations that we are aware of what's currently happening at the time.
Thank you.
I think our external colleagues have spoken. Can I just check if any of the councillors have any further comments they want to make to the recommendations, or any comments they want to say? Otherwise, I'm going to wrap up shortly. I can't see anybody. Alvin.
Yes, just to say thanks very much, Chair, for guiding us all through this process. There's been a lot of input from everybody on this, and it's just been an enormous leap of work. So thank you for doing it all.
I happily take compliments, and I thank you for that, Alvin. But if there's one person I was going to single out for the work that they've done during this, it's actually Jen Lawson, who's been pulling it together and made my life much easier. So just like to put that on record, the work that Jen has done. Nick Allen has been at a lot of the meetings, as I know a number of and I appreciate the comments that he's made in going forward. but it's unfair to single out one councillor. So I would like to thank my vice chair as well, and the other members of the panel for the work they put in. But it's been a pleasure working with the professionals, both internally and externally, and I hope it sets a measure of what we're going to be able to do in the future, and certainly we'll carry out. As I was mentioning earlier to, I'm just going to finish this, Michael.
Right, yes.
I just want to say that the recommendations will be reported to the 7th of April. We did say that we'd let all the people that we've spoken to that would be interested to make sure they've had a copy of those recommendations. And if there are any changes, they will be minor without particular effect, but we will, of course, inform our partners as we go forward. And we hope to take this forward. I don't see further. We have always said we might slip to the 26th of April, and indeed we have, because of the budget that we looked at. Michael, did you have a final comment?
Well, yes, Mike. It probably isn't a recommendation as such, but I wonder, given that I've been, like you, on previous overview and scrutiny panels, whether we should actually review it in 12 months' time to assess the outcomes, what has been achieved, the successes, what further challenges are faced. Because I'm concerned that in April we might close it off, but I do feel that in 12 months' time we should actually measure what has been achieved and the successes that have come from it.
Michael, absolutely. It's not a recommendation because it's something we're going to undertake ourselves. And it is part of the plan to look at how effective we've been in 12 months from the implementation, I believe. So it might be 9 months, a year from now, or 12 months, but certainly sometime in spring 2023 to actually review where we've gone with this has always been my intention. I think that this will be a piece of work that will be helpful to our colleagues. And Isabel, Vice Chair.
Yeah, I was really just going to say that we can only touch it at this point of time, and there's going to be some changes. So it's quite right that we should always review things, because things don't stay the same.
Absolutely.
Thank you, Michael.
I think we're all very conscious of that at the moment. So if everybody's happy with that, thank you for coming along. I know we're under a lot of pressure at the moment. I really appreciate your presence here this evening, so that we've been able to air this in public. I look forward to talking to you all in the future. Thank you very much.